Hello, I'm Dr. George, the in-house vet here at Wunderdog. If you're watching this, your dog may have been recently diagnosed with kidney disease, or you're looking for answers about supporting kidney health. First, let me reassure you, you're not alone. Chronic kidney disease, or CKD, is one of the most common conditions we see in older dogs. Studies show that up to 1 in 10 dogs overall, or nearly 1 in 3 senior dogs, will develop some form of kidney disease. The kidneys are the body's filters. When they begin to fail, toxins, phosphorus, and fluids can build up. You might notice increased thirst, more frequent urination, weight loss, or changes in appetite. But here's the good news. With the right medical care, close monitoring, and the correct diet, we can slow down progression, support comfort, and often buy years of quality life for these dogs. A common misconception is that nutrition only matters once kidney disease is advanced. That's not true. In fact, early intervention with the right diet can delay the need for aggressive treatments and protect kidney function for longer. If we delay, phosphorus continues to rise, high blood pressure can worsen, and muscle loss accelerates. In one landmark study, dogs with CKD fed therapeutic diets lived twice as long as those on regular food. It's not just about lowering protein. In early stages, dogs still need moderate to high quality protein to maintain muscle mass, while controlling phosphorus and sodium to protect kidney tissue. Later, when disease is more advanced, protein must be further restricted to reduce nitrogen waste and help control uremia, while still providing essential amino acids. Early action prevents a cascade of complications, from bone loss and anemia to malnutrition. Every meal becomes a chance to protect the kidneys and give your dog more time feeling like themselves. Here at Wunderdog, we like to think of kidney care as a circle with 3 connections: veterinary care, home care, and nutrition care. Starting with veterinary care, regular blood work, creatinine, BUN, phosphorus, calcium, and urine tests like USG or protein to creatinine ratio help us stage the disease. Blood pressure monitoring is crucial since hypertension is very common in CKD. Vets may prescribe medications such as ACE inhibitors, phosphate binders, or fluids depending on the stage. Then comes home care. Owners are the daily eyes and ears. Keep track of water intake, urination, appetite, energy, and body weight. Even subtle changes matter, like increased thirst or reduced interest in food. Monitoring these trends lets us act before crises occur. The third connection is nutrition. Every single meal can reduce phosphorus load, control blood pressure, maintain lean mass, and support hydration. Diet is the one connection you can control daily, and it works hand in hand with vet treatment and your careful observations. When vet care, home care, and precision nutrition come together, we give the kidneys their best chance to stabilize and your dog the best chance for a longer, healthier life. So, how exactly does food help the kidneys? The first target is phosphorus control. Elevated phosphorus is one of the strongest drivers of CKD progression. When phosphorus levels rise above normal, they stimulate parathyroid hormone and fibroblast growth factor 23, which in turn accelerate renal fibrosis and bone demineralization. By restricting phosphorus intake to therapeutic levels around 0.1 grams per 100 kilocalories, we slow down the cycle, reduce mineral buildup, and protect surviving nephrons from the further injury. Next comes sodium management. Dogs with CKD are at high risk of systemic hypertension. Excess sodium increases intraglomerular pressure, worsens proteinuria, and promotes fluid retention that can lead to edema. By carefully lowering sodium in diet, we stabilize blood pressure and reduce cardiac and renal strain. Then, protein balance. Protein isn't the enemy. It's about quality and quantity. In early CKD, moderate amounts of highly digestible proteins, such as turkey, duck, or egg, provide essential amino acids to maintain lean muscle and immune function. In advanced stages, when the risk of uremic toxins and nitrogen waste accumulation rises, we restrict total protein but continue supplying high biological value sources so the body still gets the building blocks it needs without overburdening the kidneys. Micronutrients are another cornerstone. Omega-3 fatty acids from salmon oil reduce glomerular inflammation and can lower proteinuria. B vitamins are water-soluble and lost through polyuria, so supplementation prevents anemia and supports energy metabolism. Antioxidants like selenium and vitamin E help counter oxidative stress, which is a major factor in nephron loss. Finally, hydration and fiber. Diets that are rich in moisture reduce dehydration and support perfusion, while soluble fibers such as pumpkin, oats, they enhance the gut-kidney axis, binding uremic toxins in the colon and reducing systemic nitrogen load. Together, these strategies don't just manage symptoms, they actively lower kidney workload, slow progression, and protect overall health. This is exactly why we developed Wundercare+Renal early and Wundercare+Renal late. Both are designed to meet dogs where they are in their kidney journey. Early stage is moderate in protein but restricted in phosphorus and sodium, helping stabilize blood work while preserving lean muscle. Late stage goes further, lowering protein and phosphorus even more, while enriching antioxidants and omega-3s to manage uremia and maintain comfort. Both are gently cooked, moisture-rich, and lab-tested for digestibility, made only with whole ingredients and balanced micronutrients. No fillers, no preservatives. They're not just safe for kidney patients, but precision tools to actively protect function and quality of life. Transitioning a kidney patient onto a therapeutic diet must always be slow and deliberate. These dogs are often seniors, sometimes underweight, and their appetite can be inconsistent due to nausea or metabolic changes. Pushing a rapid switch risks rejection of the new food and unnecessary stress on both the gut and kidneys. A minimum of 14 days is recommended for transition. Begin with 25% renal diet and 75% old food, gradually adjusting every 3 to 4 days until full replacement. For dogs with poor appetite or chronic gastrointestinal sensitivity, extend the process to 3 weeks, or longer if needed. The priority is steady acceptance, not speed. During the transition, monitor carefully stool quality, appetite, and body weight, but also water intake and urination, since changes here reflect kidney adaptation. If appetite is low, gently warm the food to enhance aroma, or add a teaspoon of pumpkin puree per 10 kg body weight to support digestion. For nausea, veterinary prescribed antiemetics can help stabilize the feeding. Above all, consistency is key. Sudden dietary changes can disrupt the microbiome, worsen inappetence, and reduce compliance. A structured, gradual approach maximizes the tolerance and ensures your dog receives the full renal protective benefits of the therapeutic diet. Day to day, there are a few golden rules for kidney patients. Always feed measured, consistent meals, never rely on scoops. Encourage hydration, whether with fresh water bowls, added moisture in food, or even ice cubes for variety. Avoid high phosphorus treats like cheese or organ meats, and stick to safe low phosphorus snacks if needed. Weigh your dog weekly, track their BCS and MCS, and never ignore changes in thirst, urination, or appetite. These are early signals of regression, and catching them early makes all the difference. The encouraging truth is that kidney disease doesn't have to mean a short or poor quality life. With careful vet monitoring, your attentive observation, and the precision nutrition in Wundercare+Renal diets, dogs with CKD can remain active, comfortable, and happy for years. And remember, you don't have to navigate this alone. If you'd like extra support once you start your care pack journey, you can book a free consultation with me. Together, we'll personalize the plan, answer your questions, and give you confidence that you're providing the best care possible.